When you think about what helps people get better in a hospital, you think doctors and nurses and medicines and new technology, right?
Yeah, for sure.
But what if I told you something as simple as the chair someone sits in while they're visiting, or the amount of sunlight in the room can actually make a big difference in how fast someone recovers?
Oh, absolutely. That's fascinating, isn't it?
Yeah.
Today, we're diving deep into how hospitals are changing the way they design rooms and furniture to help people heal.
It's not just about looks
No.
anymore.
No, not at all.
It's about how design can help people feel comfortable and safe so they can focus on getting better.
Right.
And to give you the full picture, we've looked at a bunch of different sources for this.
Yeah.
Articles about intelligent beds, guidelines from healthcare groups, opinions from hospital experts, research from design journals, even parts of a podcast script about furniture that puts patients first.
Wow, that's a lot of research.
Yeah, we really wanted to go deep on this one. So our goal today is to show you how hospital design is a crucial part of healthcare. It's not just about making things look pretty or run smoothly.
No.
It's about how the environment actually plays a role in helping people heal.
It's a powerful tool, for sure.
So let's go back in time a bit. For a long time, hospitals were all about cramming in as many beds as possible and just getting people in and out as quickly as possible.
Yeah, it was all about efficiency. More beds, faster processes, that was the thinking.
Right, like a factory almost.
In a way, yeah. But thankfully, we've come a long way since then. We now understand how important it is to design hospitals with the patient's needs and comfort at the forefront.
So we've gone from processing patients to really thinking about how to support their recovery through the environment.
Yeah, exactly. It's a total shift in thinking. We've moved from seeing the hospital building as just a container to recognizing it as an active part of the healing process.
So what led to this big change in thinking about hospital design?
Well, there are a few key factors. First, there's the rise of patient-centered care. This means really focusing on each patient's individual needs and experiences. Second, we have a huge need to reduce infections that people get while in the hospital. Those are a major problem.
Yeah, that makes sense.
And lastly, we're starting to understand how important a patient's emotional and mental well-being is for their overall recovery.
Right, it's all connected.
Absolutely.
Okay, so let's talk about some of the cool stuff happening in hospital design. When I was reading about these intelligent beds, I was blown away.
Oh, yeah, those are amazing.
What exactly makes a bed intelligent?
Well, think about it. The bed is where a patient spends most of their time.
Right.
So why not put the technology right there with them? We're seeing this in India with the first intelligent connected bed developed by Dozy and Midmark. These beds have built-in monitoring systems and early warning systems, all without needing to touch the patient. It's called RPM, Remote Patient Monitoring, and EWS, Early Warning System.
So it's like having a doctor constantly monitoring you, even when they're not physically in the room.
Pretty much. And this is especially important in areas of the hospital that aren't the ICU, like high dependency units or general wards.
Makes sense.
Places where continuous monitoring hasn't always been possible. These smart beds can really make a difference in those settings.
So how do they actually improve patient care?
In a few ways. First, they're much safer. If something starts to go wrong, the bed can alert the medical team right away. Second, it makes care more efficient. Nurses don't have to constantly check vital signs manually.
Right.
And finally, it leads to better outcomes for patients because problems can be caught and treated earlier.
It sounds pretty amazing. How does this technology actually work?
Well, Dozy has this incredible contactless sensor technology.
Oh, wow.
And they use AI-powered algorithms to analyze the data. They've taken all of that and combined it with Midmark's really high-quality hospital beds.
So you're essentially getting constant monitoring just by lying in the bed.
Exactly. And that data is super valuable.
So what kind of things can these sensors track?
Oh, they can monitor all sorts of vital signs. Heart rate, breathing rate, blood pressure, oxygen levels, even ECG readings, and body temperature.
That's incredible.
It is, right. And all of this data is continuously being collected.
But what happens with all that information?
That's where the early warning system, or EWS, comes in. If any of those vital signs go outside of a safe range, the EWS sends an immediate alert to the nurses or doctors.
So they can intervene right away.
Exactly. They can make decisions based on real-time data, and that can be life-saving in some cases.
It's like having a safety net built right into the bed.
I like that, a safety net. And these beds don't just work in isolation.
Oh.
They're connected to the hospital central command centers and their HMIS, which is the Health Management Information System.
So everything's integrated.
Exactly. All the patient information is shared seamlessly. Plus, when a patient needs to be moved to a different part of the hospital, the monitoring goes with them because it's in the bed.
That's really smart.
It is, right. It makes things so much easier and more efficient.
We actually have some quotes from the CEOs of Dozy and Midmark talking about this partnership. What were their thoughts?
Well, Mudit Donwat, the CEO of Dozy, said that combining their technology with Midmark's beds creates a really advanced solution for hospitals. He said it's user-friendly and can really change the way healthcare is delivered in India.
Wow.
He also said they really want to make the experience better and safer for patients.
So what about Midmark? What was their perspective?
Sumit Agarwal, Midmark India's managing director, said that they've been committed to Indian healthcare for a long time, and they really understand the challenges hospitals are facing.
Yeah.
And he believes that these intelligent beds are a big step towards solving those problems and creating the best possible experience for patients and healthcare providers.
It's great that they're working together to address these issues. Okay, so we've talked about these high-tech beds, but let's shift gears a bit. What about just regular furniture in hospitals? How can something as simple as an ergonomic chair or a well-placed table help with recovery?
Oh, it might seem simple, but it makes a huge difference. When furniture is designed with ergonomics in mind, it means it's made to fit the human body comfortably. This can reduce stress and pain for patients, allowing them to rest better and use their energy for healing.
So if you're more comfortable, you can heal better.
Exactly. And it's not just about the patient. Comfortable furniture is important for healthcare workers, too.
Of course, that makes sense.
Think about nurses who are on their feet all day.
Yeah.
Having chairs and workstations that support their bodies can prevent injuries and burnout so they can provide better care to their patients.
It's all connected.
It really is. This idea is often called healing by design.
I like that.
It means creating an environment where everyone feels comfortable and supported, which helps the whole healing process.
I also read about something called smart furniture. Is that the same as the intelligent beds we discussed?
Smart furniture is a broader term. The intelligent beds are a type of smart furniture, but it includes other things too. Yeah. It means furniture that's modular so you can adapt it to each patient's needs, furniture that integrates technology seamlessly, and furniture that looks and feels more welcoming, less like a hospital, and more like a home.
So it's about creating a space that feels good to be in, which can help with healing.
Absolutely. There's actually a really cool case study from a hospital in Hyderabad that shows how powerful this can be.
Oh, what happened?
They upgraded their wards with ergonomic beds and comfortable recliners, and they saw an 18% increase in patient satisfaction. They also had fewer patients getting bed sores, and the nurses reported less physical strain.
Wow, that's a huge improvement. But I'm sure some people are wondering if all this fancy furniture is super expensive.
That's a good question. While it's true that some of the more high-tech systems can cost more upfront, it doesn't mean that all good hospital furniture is out of reach.
Okay.
There are a lot of ways to make it more affordable, like being smart about where you buy things, planning carefully, using customizable furniture packages, and buying in bulk.
So you can get creative with it.
Exactly. Plus, it's important to remember that investing in good furniture can actually save money in the long run.
How so?
Well, think about it. If patients are more comfortable, they're less likely to develop complications like bed sores, which are expensive to treat.
That's true.
And happier patients and staff can lead to all sorts of positive outcomes that can indirectly benefit the hospital financially.
That makes sense. So we've talked a lot about the furniture inside patient rooms, but what about the bigger picture? How does the overall design of the hospital building itself affect patient recovery?
The overall hospital design is incredibly important. Even something as simple as natural light can make a big difference.
Really? I wouldn't have thought about that.
There's tons of research showing that patients who get more natural light recover faster.
Interesting.
For example, one global survey found that patients in rooms with more natural light healed 15% faster. And Fortis Healthcare in India reported an 8% decrease in patient anxiety after they started bringing more natural light into their rooms.
That's amazing.
It is. Natural light helps regulate our sleep cycles, which are crucial for healing.
That makes sense. What about ventilation? Seems like that would be really important in a hospital, especially for preventing infections.
Ventilation is absolutely essential. Good ventilation systems help clear out germs and keep the air clean. One study found that hospitals with better ventilation had 20% fewer infections.
Wow, that's significant.
It is. But unfortunately, in India, some government-run hospitals, which are often overcrowded and under-resourced, have much higher infection rates than the global average. And poor ventilation is a big part of the problem.
It seems like having enough space and good airflow are crucial. And what about the ability for patients to move around? Is that important too?
Being able to move around is really important for recovery. Hospitals that have open spaces where patients can walk around safely tend to have fewer complications after surgery.
So it's not good to just be stuck in bed all the time.
No, not at all. Movement is really important for healing. Some hospitals in India, like Apollo hospitals, have started to design their buildings with this in mind.
It seems like everything is connected.
It is. The furniture, the lighting, the air quality, the ability to move around, it all contributes to a healing environment. And even the layout of the rooms themselves can make a big difference.
Really? How so?
Rooms that are spacious, have views of nature, and let in lots of natural light can help patients recover up to 16% faster.
Wow, that's pretty amazing.
It is, right. And we're seeing this trend in a lot of private hospitals in India. For example, Max Healthcare has seen a 10% improvement in recovery times for patients in rooms with natural views.
That's fantastic. And I know there's been a lot of talk about single patient rooms and how they help with infection control.
Yeah, single patient rooms are much better for preventing infections because they reduce the risk of germs spreading between patients.
That makes sense.
But unfortunately, in India, cost and space limitations mean that not all hospitals can afford to have all single patient rooms.
Especially in government hospitals.
Right. And when you have patients crowded together in small rooms, the risk of infection goes way up. In fact, one study found that patients in these kinds of rooms are 25% more likely to get an infection. This is a big challenge for a lot of government hospitals in India that are already over capacity.
So good design is essential for keeping people safe from infections.
Absolutely. Infections are a serious problem in hospitals all over the world.
How common are they?
In developed countries, about 7% of patients get an infection while they're in the hospital.
Wow.
But in developing countries like India, that number can be as high as 15%.
So there's a big difference.
There is. And good design can make a big difference in reducing those numbers. Things like having more single-patient rooms, using advanced ventilation systems, and designing hospitals in a way that minimizes contact between patients can all help.
The data really shows how important this is.
It does. One study found that advanced ventilation systems alone could reduce infections by 30%.
That's huge.
It is. But in some government hospitals in India, infection rates are still over 20%, partly because of outdated designs and poor ventilation.
That's concerning.
It is. Private hospitals in India, like Apollo hospitals and Narayana Health, have made infection control a priority in their designs, and their infection rates are as low as 8%.
So there's a big gap between public and private hospitals.
There is. Public hospitals average about 15.5%, while private hospitals are closer to 8 to 10%. That really shows how much design can impact patient safety.
Overcrowding also seems to play a big role.
Yes, overcrowding is a major problem. Globally, it's estimated that overcrowding increases the risk of infection by 25%. And over half of public hospitals in India are overcrowded, which makes infection control even harder.
That's a tough situation.
It is. But the Indian government is working to improve things with programs like the Pradhan Mantri Swasthya Suraksha Yojana, which aims to increase hospital capacity and address overcrowding.
That's good to hear.
It is. Some of the leading hospitals around the world are achieving amazing reductions in recovery times through innovative design. And private hospitals in India are making progress too. But government hospitals still face a lot of challenges, even with government funding dedicated to improving their design and infection control measures.
It seems like we're moving away from just treating illness to creating environments that actively support healing and well-being.
That's exactly what patient-centered design is all about. It's about recognizing that the patient's emotional and psychological state is just as important as their physical health.
So it's a more holistic approach.
Exactly, and there's research to back this up.
Really?
Yeah. Studies have shown that hospitals with patient-centered design features like gardens and social spaces have patients with lower anxiety levels.
That makes sense.
It does. In India, hospitals like Manipal hospitals are using these principles, adding quiet areas, incorporating art, and making sure patients have views of nature. And they've seen a 9% increase in recovery rates and a big drop in stress levels.
That's impressive.
It is. And this approach is especially important in places like mental health facilities and children's wards, where creating a calm and supportive environment is crucial.
It's incredible how every aspect of the hospital can play a role in healing.
Right. From the bed you lie in to the light coming through the window to the layout of the building, it all has an impact. Hospital design isn't just about functionality anymore.
It's about creating a space that supports healing on every level.
Exactly. It's about recognizing that the environment itself can be a powerful tool for recovery.
And those little details, the things we might not even think about, like a comfortable chair or a nice view, can make a big difference.
They can. We're seeing amazing progress in hospital design, especially with new technologies and a focus on patient well-being. But there's still work to be done.
Especially in making sure that everyone has access to these advances.
Exactly. It's an ongoing process, but we're moving in the right direction.
It's been fascinating to learn about all of this. I think most people don't realize how much thought and research goes into designing these healing environments.
It's a really interesting field where design and medicine come together to make a real difference in people's lives.
So as we wrap up, I want you to think about the hospitals in your community. What are they like? Do they feel sterile and impersonal?
Yeah.
Or do they have features that make them feel more comfortable and welcoming?
Good question.
Think about what's important to you when you're in a hospital, or what would be important for your loved ones. Because the design of these spaces can have a real impact on how we heal and how we experience healthcare.
That's so true. It's definitely something to think about.
It is. We often don't pay attention to these things, but they can make a world of difference.
Absolutely.
So thanks for joining us today. I hope this has been an eye-opening look at the power of hospital design.
It's been a pleasure. It's great to see these positive changes happening in healthcare.
It is. And hopefully this conversation will inspire people to think more critically about the spaces where healing takes place.
I hope so too. It's an important conversation to have.
It is. And we all have a role to play in advocating for hospitals that prioritize patient well-being in every aspect of their design.
I agree completely.